All right. Of the 155 accredited medical schools, 100% have admissions policies supporting diverse students. 97 have senior leaders committed to DEI, diversity, equity, inclusion. 89% say DEI is prioritized. 91.1 have parental leave regardless of gender or sexual orientation. U.S. Representative Dr. Greg Murphy wants to change that by denying federal funds to medical schools that have DEI programs. All right, Congressman, good to see you, sir. Thank you. Is this really a problem? Are we in a solution in search for a problem, or is this actually happening?
It's a major problem, Leland. You know, as you point out, the infinite majority of the schools that we're seeing right now have DEI programs, which by definition is divisive. We're trying to put healing and race relations together. We're destroying that. Even more so with what DEI is doing, it's not only attacking in the admissions process. Look at what's being taught in the school itself. We're being taught to have social justice warriors, not physicians. What does having a discussion about social justice issues have to do with learning where your appendix is or what a gastric ulcer looks like? Yes, by far, we have different issues that deal with different races. We always have, and that's what we're taught in medical school. We're also taught in medical school previously to take care of whatever patient is in front of you, regardless of race, sex, gender, whatever they call it, or any type of things now. But now what we're seeing are quadrants and particles within the school itself that says, look, you know, I don't feel comfortable around white doctors. Or, you know, it's not okay if somebody makes fun of my pronouns walking around as a medical student with a political statement on. This is absolute nonsense.
Okay, so hold on. I guess we're separating two things, right? One is how the medical schools conduct themselves, then there's medical education, and then there's admissions. Deal with them in each silo.
Sure.
Your Educate Act eliminated all federal funding, you know how to hit them where it hurts, including student loans for medical schools that engage in the worst, in your words, DEI practices. No racist teaching, no racial discrimination, no loyalty oaths, no DEI offices. So you're not, I just want to be clear, are you taking an issue with, say, that diversity is a good thing?
No, not at all. I think diversity strengthens a population. The problem is when you force it, when individuals, look, guys, we're not dealing with art school. We're not dealing with English school. We're talking about medical school. We're talking about where people's lives are at stake. And so
do you have specific examples of where medical schools, and to get back to what Elon Musk was saying, where standards are being lowered in the name of racial equity?
If you look at some of the charts, like we can cite them here, we show that the admissions rate, who gets in, depending according to race and MCAT scores, is markedly different. And MCAT scores are a direct correlative to your ability to understand, fully digest the body of knowledge that you have in medical school. And then your other tests in medical school talk about how well you're going to do as a clinician. These are what's happening today. And, you know,
so what you're saying is that if you're white, you need this score to get in, and if you're black, you need this score to get in.
No, it's a much marked discrepancy.
Okay, so we'll go. But at that point, what you're saying is that there's research that if you have an MCAT score down here, we can trace that out, that your abilities as a physician are not going to be as good or as qualified as somebody with an MCAT score up here.
Yeah, that's always been the case. It's nothing new today than it was 25, 30 years ago. People want their physicians to be trustworthy. They want them to be the smartest. They want them to be the best diagnostician.
In a weird way, and I think this point's, I'm not making any new point, but you go to your physician and you see a degree from Harvard or NYU or Columbia or Hopkins or whatever it is, some great school hanging on the wall, and that person is of color. Suddenly you're wondering, hey, did they get in and they get a diploma because of their race or because they're really that good? It's sort of the most unfair to the highest achieving people who would have been.
Ask Dr. Ben Carson what he thinks about DEI. He thinks it's horrible in medical schools because it takes away merit and throws all these identity politics factors in.
You know Joe Biden's not going to sign this, right?
I know, but you know, it's honestly a shot across the bow. The AAMC, the American Association of Medical Colleges and Universities, Dr. Skorton is running this. He did the same things at other institutions, and this is polluting what is the last bastion of really, I believe, excellence in this country. We should demand excellence from our doctors, not identity politics.
Oh, you would know. Thanks for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.